Hey everyone, Mark Versen, Chief Development Officer, Lutheran Family Services. Hope everyone's hanging in. Hard to believe that we at LFS are in week 9 of our emergency telecommuting procedure. As we continue our series of connecting through COVID-19, we have a special guest today who is on the front lines with their staff and in Lincoln with Bryan Health. And so we're going to dive right in because we're really we're switching the tone a little bit from what we have been doing of our LFF services. Because this is something that as community members, we need to get through together. And so with that, I'll turn it over to Joel and we'll dive right in for a few questions and go from there.
Thanks a lot, Mark. Hello, everybody out there. Joel with Lutheran Family Services, joined here by Bob. Bob, first of all, I want to make sure that Karen had a good Mother's Day. Is that a fact?
Yeah, she had a great Mother's Day. Yeah.
Well, I think everything's going to be off to a good start here. Keep those moms happy and she's a neat lady.
Yeah.
Bob, go ahead and start. Give us your title. Tell us what you do over at Bryan, would you?
Well, I'm the Vice President for Advancement, and that covers basically all of the externally related things at Bryan, from strategic planning to PR marketing, media relations, the Bryan Foundation, and heaven forbid, I always used to say crisis communication, but we've had to dust that one off and do a little crisis communication here as of late.
I was going to say that part of your job is probably being explored as much as ever. You know, speaking of communicating things, what would you say to people who know Bryan as a quality network for medical services, but during this time, is it still what's it like for the patient experience? Are you still seeing patients?
Yeah, we're still seeing patients. I think our overnight census was 367-ish, something like that. You know, typically we were high 400s to low 500s on our average daily census. So it has dropped intentionally, partially because of the cancellation or postponement of elective surgeries, but those are starting back up. And it's very quiet here. For one, I mean, not quiet behind the scenes working with patients, but there are visitor restrictions. We have a fair amount of our non-clinical staff working from home. So it's a very quiet place from what people who had visited our 2 campuses would have experienced in the past. But it's a very safe place still, and in fact, it's probably one of the safest places in the community because everybody is wearing masks. The clinical folks are all in their personal protection equipment. With all of the visitor restrictions, it's a very sterile environment. So it is a safe place to receive care. We want people, if they're not feeling well, to know that, well, if it's an emergency, mandated or required visit versus like an urgent care visit, it's still safe to come here. We kind of are working on what I would say is a 3S mentality. There's the first step for patients coming in. It doesn't matter if you're an ED patient or someone with a surgery, is to ask some screening questions that might require getting a test. It might not, but after that screening is done, the second S is really separation. There are separate entrances. There are separate units for COVID versus non-COVID. We've separated a lot of our operations, and then the third S is definitely safety. And there's nothing we're doing that, in our opinion, isn't safe for patients, our employees, and our physicians. So yes, we're still open. We're still treating lots and lots of people, more non-COVID patients than COVID patients, and those postponed elective procedures are starting back up.
Yeah, Bob, you mentioned safety and talk to us a little bit about, on your website, you guys have a page, and I'm looking at it as well as we're talking about the importance of wearing a mask. And, we hear it out there in the public, yes, it's important and so forth, but talk to us a little bit about the severity around it and why, even though that you may not have the mask for your own protections, if you will, of how that can really help with some of the spread and where you guys see that from a safety standpoint.
Yeah, it's vitally important. Last week in one of our press briefings, Dr. Bill Johnson, a pulmonologist, frankly, I've never heard such an impassioned plea from a physician to the public to wear a mask. It was very impactful. This graphic has been developed, and basically the main issue, Mark and Joel, is the asymptomatic transmission of this. Unlike past things, even H1N1, people would spread the disease after they got sick. Well, most people are asymptomatic, meaning they're not showing symptoms, but they have it and they're spreading, which makes this one so much different than other ones. So basically what Dr. Johnson told us to do in his visual is that if you are that asymptomatic carrier, or you're someone that has been diagnosed with COVID and you can spread the virus, if you are wearing a mask, well, let's put it this way. If the healthy person is wearing a mask and the sick or the carrier is not, the transmission probability is extraordinarily high. So the mask gives you just a small measure of personal protection. It is really about protecting others, because none of us really know if we have it or not. If you flip that around and it's the COVID carrier or the asymptomatic carrier that wears a mask, and then the well person is not, it marks, I mean, it's a marked difference in the transmission rate of that. If both are wearing a mask, you knock this thing dang near to zero, because it's stopping the carrier from spreading it, and then that small measure of protection on the other end of the healthy person. The double masking is just, you know, very powerful. So we're very supportive in the medical community. Speaking on behalf of the physicians I have the privilege to work with, of everyone wearing masks whenever they're in public. It does not replace the social distancing at all, but you put in the social distancing with the double masking, that's how we can really re-enter society a lot more carefully than if people are going around unmasked. So don't be ashamed or bashful or embarrassed by wearing one. Please spread that word and spread it to your family, your friends, anybody who will listen, that it's important to wear.
You mentioned speaking for physicians or speaking for those providing services. Everyone hears this message over and over, you know, talking about those frontline people. But of course, on behalf of everyone at LFS and everyone watching this video, please pass on our gratitude for those people doing that frontline work. And you talked a little bit also about your services within the building. What's going on externally as far as testing, as far as Bryan Easy and some other things? So alert the public of some of those ideas.
Yeah, we kind of have a couple of different options for testing that we've done, and I don't know if the numbers are still holding. I'm guessing they're probably around 85% to 90%, but up until just recently, Bryan had provided about 90 to 92% of all of the tests that were done in Lancaster County. And it's either been through, the first thing we really set up was our urgent care walk-in clinic. That was the first thing we did. And we have the drive-through clinic out at the Bryan Life Point campus, certainly testing in the medical center. And then just recently we've fired up a mobile clinic that can go where it needs to go. So all told, as of this morning, we had administered about 5,500 tests, and there's about 737 positives now. Most of the testing has occurred at our drive-through. We can handle like 160 in each shift. Some days there's a morning and an afternoon, sometimes just an afternoon. But yeah, what's it say here? 3,800 of the 5,500 tests have been conducted through our drive-through. Another 872 in the hospital, 350 at our urgent care, and then 443 at our mobile. So there's a lot of different options. Test Nebraska has now kind of put up their shingle in Lancaster County. We're hopeful that will help as well and meet some of that community demand, because right now it doesn't matter if it's us, St. Elizabeth's, and even there's that screening element of Test Nebraska, that these are people that are hitting some criteria and feeling crummy if they're getting the test. And it's really important to find out where this is in communities, so you can do everything the health department does with contact tracing and isolating to prevent the spread.
Now, Bob, you've talked a little bit about the testing, but how does someone go about getting it? Because we've heard from some of our clients as well that the hesitation almost is, what if they won't test me, or how much does it cost, too much money, or say I don't have insurance? Talk to us a little bit about kind of that process as well, because from your side of it, this is the main goal is just to get those tested that need it, correct?
Yeah. So, we've actually had a slight change, Mark. I should back up. The first thing that we did is we set up a special module through our Bryan Easy Visit, where you could do an online screening. And then if, the screening revealed that you could get a test, it counted as your physician order to go out to, the drive-through, walk up, wherever it might be. And with the special code, you could have all fees waived. But just to streamline it a little bit more, frankly, all people need to do is go to the bryanhealth.com webpage. There's going to be a banner at the top that says COVID testing, and it's essentially those same screening questions. They're being triaged right to the infection prevention physicians for the physician order to get going. Bryan has great financial assistance programs. If anybody is at all nervous or ambivalent about getting tested because of their ability to pay, tell them not to. That test will be waived by Bryan, and for some people that do have insurance, you run them through and you'll see what's covered. But for those that are not, people fall under our typical financial assistance, policies and procedures, and they will not endure unnecessary costs to treat their COVID-19. So tell them to go, and if they're not feeling good, it's important for them and anybody that they're around to find out what they have.
Well, Bob, those are some excellent updates. I'm really looking forward to the time when we can interact in person again. I'm going to heed your advice and wear my mask when I venture out. But that's all I have. Mark, let's thank our great guest, Bob, here today.
And put it on properly. You always grab from the ear loops and go like that. Never touch the outside. When you take it off, lay it down. I have a sanitary kind of napkin over here, and then that's my mask for the day. And as soon as I leave my office, it's on. If you were in Bryan now, that's what you would see, is a bunch of people walking around with masks, for sure.
That's great. And yes, Bob, thank you so much for jumping on with us today, illustrating the mask, but also just for the work that you all keep doing at Bryan to try to impact the spread and limit the spread across Lincoln, Lancaster, and other sites. And so we appreciate all that you are doing, and we hope that you and the rest of your staff continue to stay safe and healthy. And for everyone else out there that is tuning in, thanks for watching today. Again, a little different tone from what we have been doing about LFS services, but there are still ways to make an impact, especially around this video. Share it within your networks so that way it is getting to the right folks that may need to see this. And that's one of the big things about us jumping on and doing this today is just trying to, if we would talk about the spread, to get this to go viral, if you will. And let's get this shared out there so that our community members and our neighbors know what needs to be taken or what steps need to be taken in order to get the testing to also help limit the spread within our own communities. And so with that, Bob, I really do appreciate the time. Joel, as always, good to see you, and everyone else, stay healthy and safe, my friends.
Thank you, guys. You're doing a great job. See ya.
Thanks, Bob.